In today's episode, we're going to talk about building trust and how do effective healthcare compliance programs build that trust. In the complex world of healthcare, trust isn't just nice to have. It is the foundation and the building blocks behind every organization and their integrity. How does a compliance program build that trust while continually trying to meet the necessities of following the regulations? Why is it that when trust flourishes, patient care improves, and organizations thrive? Reputation exceeds the expectation for the industry, especially in healthcare. There's great stories to the key elements of what makes a compliance program truly effective. We are going to dive deep into the heart of healthcare compliance and how to establish that trust within the organization and within the healthcare community as a whole. Whether you're a healthcare professional, a compliance expert, or just someone who is intrigued by the dynamics of trust in medical field, this episode will shed light on the critical role compliance plays in building and maintaining that trust. So let's get started and explore how we can transform compliance from a requirement to a cornerstone of healthcare. Welcome to the Compliance Leadership Lounge. I'm Ross Ronan, your guide for insightful discussions in healthcare compliance. In our lounge, leaders and experts gather together to share their perspectives and wisdom. So grab a chair, make yourself comfortable, and join the conversation as we dive into the strategies and stories behind effective compliance leadership. Whether you're a CEO, board member, or a compliance enthusiast, you're in the right place to learn, grow, and lead with integrity. Today, we're going to talk about trust and emphasizing the trust that a compliance program needs to have within the organization so that it actually remains effective. It's really important that CEOs and boards understand that they can rely upon their compliance program to not only be knowledgeable about the industry, about the issues that they are working through, and able to provide them adequate advice and guidance, and not to go off and make something, a mountain out of a molehill, if you will, right? You want to make sure that they can trust you to bring the right things to the right level and to make sure that they're important enough and the risk is high, moderate to high risk, so that effect can be changed. Trust has always been defined in healthcare because patients really rely upon healthcare providers, whether they're doctors, nurses, hospitals, whomever, to put their lives in their hands, to be able to say, hey, come diagnose me. Hey, come take care of me. I have these problems. I really need you to fix them. And probably the most vulnerable people in the world are people who are sick, are patients. And they have to rely upon that trust to make sure that they can actually get and receive that health care. Providers need trust too. Providers need to be able to trust their counterparts. They need to be able to trust the ancillary providers who are working with them, the doctor, the nurses, the medical assistants, the physician's assistants, the lab techs, the x-rays, the whomever it may be. They have to be able to trust to make sure that everything is going correctly. And then CEOs of hospitals or practice management groups or different types of entities maybe have to be able to ensure that their team is looking out for the patient's best interest in healthcare. The only way that we're able to manage the process and manage great healthcare in this industry is to ensure that everybody can rely upon everybody else. Trust is a necessity within healthcare. And when we look at going into compliance, compliance is really important in the trust realm as well, because a compliance program really has the window into the soul of an organization. What is it really doing? What's really happening? We're always asking the questions. We're always pulling out information. We're always telling people to come to us if they have a problem, if they have a question. To be able to do that, these individuals, whether they're the highest levels of the organization, the boards, the CEOs, the CFOs, the COOs, or the individual patients, or even in every provider that's providing the services, they need to know that a compliance program is a place of security, is a place that they can trust, that they're not going to be retaliated against, that their information is going to be investigated, that matters are going to be handled on a routine basis, and they're going to be able to solve these problems and reduce risk within an organization. And if there are problems within an organization, it's really important that the individuals who are making those complaints or who are receiving that information can reasonably rely that it's going to be fixed. If things just get buried or you put your head in the sand, trust will go out the window. You have to be able to trust that somebody's going to do something with the information that is provided. That's not only just compliance. If I have a complaint, it's your provider, it's your physician who receives your lab results. If they receive something that shows that you have abnormal blood work, they have to be able to do something with that. Otherwise, what's the point? Right? They have to be able to trust that things are going to happen and things are going to be mitigated, which is really important from that standpoint. There's one point in time in my career where I was dealing with a lot of different compliance officers within my same organization. So we'd share resources, we'd share different entities. We were a very large entity at one point in time. The idea was that as we were kind of developing our own, coming through the ranks of compliance officer positions, that my counterpart would tend to lose trust with some of the operational units, right? So some of the operations would turn around and go, hey, by the way, I'm not quite 100% trusting what you're telling me. I feel like you're giving me a best practice. I feel like you are telling me what you think I should do instead of something that is required that I need to do. Because what you're telling me that you think I should do sounds like a best practice, and it's really going to put the operations in a bind, in a pickle. We're not going to be able to do what you want us to do because it just doesn't work that way. It's belts and suspenders. It's too much constrictive work here when really that's just a best practice and the requirements are here. Eventually that person ended up leaving and going someplace else and having a different type of career and job. But I'll tell you, it became a big issue within the organization because as the compliance program, we all started to look at it as saying, hey, people are questioning us. People are questioning our ability to know the law, how to interpret the regulations, and how to implement those regulations and make them operationalized because somebody had their own best interest at heart versus the best interest of the company. Trust was lost, and therefore we had a huge amount of restoration that we had to build within the company. Additionally, we had at one point in time in my career multiple corporate integrity agreements. This is really interesting because, as you deal, if anybody has dealt with a corporate integrity agreement, what that is an agreement that you have with the United States government, the OIG, to say, hey, by the way, we understand we might have done something wrong and may not have been the best at having a compliance program in the past, but we will live by these rules, i.e. the 7 elements of a compliance program, plus auditing and monitoring, all the other things that are required to do, as well as annual reports and disclosure pieces. So, as you're starting to develop these corporate integrity agreements with the federal government, the OIG, the Office of the Inspector General, when you first start, your monitor does not trust you. Right? There is a reason that you got into trouble in the first place, ended up paying a big fine, and ended up being in a corporate integrity agreement. They have said, we don't trust that you're going to do what we tell you to do, and therefore we're going to make this required document, make you required to have implement a compliance program. So we had this a lot in my previous works and in my previous life. And what ended up happening is when we find out issues, even under a corporate integrity agreement, or we continue to find out issues later on, we would come to the government and say, hey, look, by the way, we found this. We're going to fix it as we did before under our corporate integrity agreement. And therefore, what it did is started to build trust within the Office of the Inspector General. They're always going to have skepticism because they're the enforcement action, they're the enforcement body, and they should. But at the end of the day, they really want to know that the individual, the compliance officer, the company, the CEO, the board, the whole operations of the company does have a compliant culture and is willing to implement the elements that it needs to prevent, detect, and mitigate issues and avoid harm to the federal healthcare program. So after a while, after our several corporate integrity agreements in different lines of business, we became one of those people who said, by the way, they're doing this. Ross is involved. So-and-so is involved. The CEO is a part of this. They know what to do. We trust that they're going to clean this thing up, even though they acquired something or they did something on the back end. We have faith and trust that they're going to fix this thing. That's the epitome of building trust. If you can build trust with the Office of the Inspector General and the monitors go, hey, by the way, that's the compliance program that you need. That is the ultimate trust, because every CEO, every board, every management company will go, we know we're doing the right thing and we have the best in class and we have the best related to it. So when you talk about the key elements of an effective compliance program, we all know the 7 elements. We define them in different categories: leadership, chief compliance officer, compliance committee, right? That's really important to have the right individuals as the first element of a compliance program, because that's the individual who's going to drive integrity and trust within the program. They're going to set the bar. They're going to see what guardrails need to be set up across the organization as the compliance officer, and they're going to be able to build that trust and make sure that people can reasonably rely on them as a trustworthy partner, someone with integrity, and someone who is strategic in their understanding to be able to reasonably rely on the growth of the business and trust that they're giving them the right advice. When we talk about policies and procedures and standards of conduct, the policies and procedures, you have to make sure that they are relevant. You have to make sure that they are appropriate for your organization. If you throw a bunch of things into your policies and procedures, like a law that doesn't matter to your specific specialty, it's a great example. I see a lot of people want to throw Stark law into their policies when they have no designated health services, nor do they have anything associated with any designated health service across the board, right? And what that does is that creates confusion within the organization to say, I don't understand why you're telling me I can't do this, right? Because you're telling me I can't do this, and then people start regurgitating this down the road, go, I can't do that because it's a Stark violation. And then we're like, what designated health services are you providing that you're really worried about? And they go, well, we don't do anything. Then you have to backtrack and go, well, that really doesn't apply to you. And then they go, okay, well, why do I have a policy on that? Trust is therefore broken. Same thing with EMTALA. EMTALA doesn't apply to everybody. It applies to emergency rooms in different situations. So not everybody has an emergency room. You don't need a policy on EMTALA if you don't abide by EMTALA, and you don't have to do that. And then really overreaching your policies and procedures is really a problem as well. When you start getting into other people's realms, I see this a lot with compliance programs, and they go, well, one of the 7 elements is standards of conduct, policies, and procedures that I need to implement. Hey, I'm going to go implement workplace harassment or sexual harassment. That's an HR function. HR is a form of compliance. They're complying with regulations as well, just maybe not healthcare regulations as it applies to False Claims Act, fraud, waste, and abuse, random kickback statute, et cetera. They're dealing with employment-related compliance matters. Big C versus little c. I talk about this a lot. Big C is compliance, healthcare compliance, the requirements of the 7 elements, the requirements that you have to have an effective compliance program as defined by the Office of the Inspector General, the Department of Justice, and the Affordable Care Act. That's the big C. The little c is everybody has compliance with everything, right? You have to comply with wage and hour. You have to comply with sexual harassment. You have to comply with payroll records. You have to comply with quality standards. There's all kinds of little c's around there that everybody does on a daily basis. Doesn't mean you need a big C compliance policy on it. Once the big C compliance policy starts impeding into other people's arena, now you're holding everybody accountable to this. I have a compliance policy, I being the company, have a compliance policy that now is in place and nobody's following. As they say, and I say this all the time, you might as well not have a policy than have a policy that you're not following. It's the worst thing that you can do, right? So staying in your lane under the policies and procedures requirements for an effective compliance program means that you're doing relevant policies associated with your compliance program, and you're not overstepping your boundaries into somebody else's realm. It's not your job as compliance. That's HR's job. That's quality's job. That's legal's job. That's risk management's job. Empower them to be powerful, and therefore you will build trust across the lines, across the business model, so that you have partners in the industry. You don't just wait until somebody says, hey, by the way, compliance said I couldn't do this, and then you become the person that people whisper in the corner going, oh, compliance is coming, let's not talk, let's not talk. People don't want to talk to you. The worst thing you can do is not have those other aspects. Leading into my next factor from a compliance program element standpoint is the open lines of communication. This episode of the Compliance Leadership Lounge is brought to you by Ronan Healthcare Consultants. At Ronan Healthcare Consultants, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards, we elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Consultants is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Consultants, redefining compliance, empowering leadership. Visit us at www.ronanhc.com to learn more. Now back to the show. We call it a disclosure program. And this is really important because, as I said before, this is where people start trusting you to deal with my stuff. I'm going to tell you a problem I have with the organization or this individual or something that I believe is a policy violation or somebody is doing something wrong. Perception is reality for that individual. If they believe in good faith that this is a violation of policy or they believe that it's a violation of law or a regulation, you got to listen to them. That is their reality. And you have to appreciate that and you have to understand it. So you take everything that's important, you take everything that's an investigation, you take it seriously, and you actually work through it to the end of it till it's mitigated. So having these open lines of communication will never work if you don't build trust within the organization to say, come talk to us. I'm not your pastor. I'm not your priest. I'm not anything of that nature, but I am someone who's listening and I'm someone who can fix things and I'm someone who can mitigate them to resolution. And I'm also somebody who can tell you that, hey, that's not a violation of law, or hey, that's not an issue here. And I'll tell you why. And I'll tell you why you can get comfortable with it. If you say that and it is true, you're building trust within the employee base. You're building trust with patients. You're building trust with providers. You're building trust with your CEOs and your boards of directors and your other counterparts, your other like-minded individuals that are your CFOs, your CCOs, your COOs, and the like. So the next one is auditing and monitoring. That's how you monitor the business, right? That is a requirement for the organization, for the OIG, for the DOJ, for the Affordable Care Act. That is just testing. Are you making sure what's going on here? That is something that builds trust within the organization because controls and testing make sure that you're doing the right thing. They can turn around and they can sleep better at night to go, yes, I know we are doing X, Y, and Z. I saw this at the Executive Compliance Committee. I reviewed this results. We talked about it. We had conversations about what that means from an exposure standpoint, but you have to be able to test and monitor each one of these different aspects under your monitoring and auditing program. Otherwise, nobody, including the OIG, CMS, are going to believe you, believe being trust, believe that you are doing what you need to do from a compliance program standpoint. The last few are pretty benign, I think. Training and education is really getting out there and making sure that you're providing the right information to the right people. You don't want to confuse them. You don't want them to go, I don't understand what you're saying. Have you ever been in that situation where you're sitting there listening to somebody talk? You guys may think the same thing talking about this on this podcast going, what is this guy talking about? Which is fine. But sometimes you're just sitting there and you're like, I don't understand what you're trying to tell me because it's not relevant to my situation. It's not important to what I'm doing today, and it's not helping me with my job. So training and education is really important from a compliance standpoint to build that trust so that that individual who's receiving that information can do something with it. It has to be knowledge, practical knowledge that I can implement. This is a regulation I shall not violate, right? We will not knowingly submit false claims to the federal government for reimbursement. Period. End of story. That is something we are not going to knowingly do. We're going to have controls in place to make sure we're not doing that. We're not giving brown bags of money to people in exchange for referrals. That is wrong. That is a problem. That is integrity. And if you're telling people what to do, they will trust that they will be able to do the right thing and do their job appropriately. The last two, corrective action plans and investigating matters, those are really important. They kind of wrap into the entire compliance program to ensure that situations are being dealt with and they're being managed accordingly. When you have an effective compliance program, the entire circle of life continues under the 7 elements, right? And what does that do? That builds trust within your organization and your leadership so they can say, I can go run this business and my compliance program is going to make sure I don't run afoul of it. And even if I have some harebrained idea that I want to put out there, I know that I can go to my strategic compliance officer, my strategic compliance executive, and I can say, Ross, what about this? How does this work? Am I able to do this? Right? When you start being aggressive, best practice, you can't do this, you can't do this, you can't, there are some things you can't do. Brown bags of money in exchange for referrals are something you can't do. There's no way around it. You can't do that. It's not right. It's wrong. But finding ways to do the things that you want to do, if it's within the rules and regulations, is how you build that trust. As we build compliance programs throughout the country for different healthcare organizations, we do unwind a lot of compliance programs that have really destroyed trust. And they've destroyed trust in a couple of different ways, as I've alluded to before. One of them is they've given wrong guidance. They didn't understand the regulation. They gave the wrong guidance, whether it was HIPAA privacy matter, a breach issue, whatever it may be. They've just really given the wrong advice. And compliance officers, like everybody else in the world, can have an ego issue. You really don't know whether or not that person wants to stick with that opinion because they have an ego issue and they don't want to be wrong, or they really truly believe that way. So we've had to come in quite often. I'm the kind of person who will tell you immediately if I did something wrong, right? And if I truly believe that I've done it wrong, I will admit to it and go, yeah, that was not right. Yeah, that was a wrong interpretation. Now, I really do a lot of things up until that time period to make sure that I don't give the wrong advice. But on occasion, it's happened where I have to kick things around with the general counsel, with outside counsel, with another compliance officer, my mentors, to say, hey, by the way, does this sound correct? Using the wrong words is a great one. Does this sound correctly? That's a great example of not producing the right words. And I admit it. But when we come into compliance programs and we really do have to unwind them, it happens more often than not because the board and the CEO have lost faith in that compliance program and they're very nervous about it. When you look at compliance programs and what do they do within an organization and how do they help build stability, how do they help advance a healthcare organization? Whether they build trust, they do it with integrity, they have an infrastructure in place, they have a compliance executive instead of a compliance officer running this thing. The long-term benefits of having anybody in an effective compliance role in a compliance program are endless. Lots of times when you look at it, it's really hard to define the ROI. And a lot of people will say compliance programs are a cost center. It's a cost of doing business. You have to do this, you have to do that. And that is true. It is a cost center. Technically, it's not bringing in revenue like every other operational unit. But what it can do is it can protect your revenue. The money that you work hard to get to help provide those services, you want to keep. Right? It's important to be able to do that. You don't want to give it back. And if you do things wrong, if you don't have a compliance program that detects, prevents, and mitigates through the 7 elements, you end up giving that money back. So you might as well not have made it in the first place. Plus, there are fines and penalties on top of that, which you really don't want to do because then it will have extra cost to implement in a different compliance program because you've violated the law. That's really important to protect your investment, protect the things that you have worked hard for. And that's a form of ROI. A different form of ROI is reputational integrity. When people look at those companies, those healthcare organizations, and I'm not going to name them, but there are several of them out there. If you go through the Office of the Inspector General and corporate integrity list and kind of start listing out different entities who may have done something wrong or may have been closed, if you go look at enforcement actions, reputationally, they run the risk of people going, I don't want to be a part of you. I don't want to do business with you because you may lack integrity. Now, just because someone has a corporate integrity agreement does not necessarily mean that they're untrustworthy. As a matter of fact, if they've had a corporate integrity agreement, they're actually probably more trustworthy than anybody else. But if you go to the enforcement actions under the Office of the Inspector General and people are like, so-and-so was sentenced to 5 years in prison and had to return $2.5 million or $20.5 million, those people will probably never work in healthcare again. They have lost their trust. And that's really important to be able to say, what's my long-term benefit of having an effective compliance program and an effective compliance executive is so that we can build trust within the industry that we will detect, prevent, and mitigate things. We're always going to have something happen. It's not about if, it's about when. And it's about how you react to it and how you mitigate it versus stopping it from happening. Can't stop everything. I wish we could, but we can't. We can't stop everything. All we can do is have controls in place and prevent, detect, and mitigate things as they go on. It's really important to have that piece of it, to be able to have that reputation that somebody is buying, contracting with, working with a healthcare organization with integrity and trust, because I believe that they have a compliance program in place. Additionally, when we look at how compliance programs can help enhance patient care, is that when we talk about, like, say, a coding and billing review, when we come back and we get those audit findings, a big portion of that is looking at the documentation. I'd say probably 90-95% of it is looking at the documentation within the medical record and say, hey, you did all these things, but you didn't write them down. Or, the worst case scenario is you said you did all these things, but you didn't do them. Either way, it's a patient care issue. If someone has a doctor who doesn't really want to document everything that they've done, how is that a good continuation of care? And how is that good providing good patient quality of care, right? Some other doctor down the road, some other specialist is going to pick up that chart and go, wow, you didn't really have much done that time. Did you have an EKG? Did you have a colonoscopy? Did you have a biopsy? Well, I don't see it on here. You billed for it, but I don't see anything written here. How do they know that that improves patient care? So, with a compliance perspective, we want to make sure the documentation matches the codes that are given or the codes that are billed. And we want to make sure that the doctors are doing everything that they need to do to make sure that they are capturing that revenue and therefore creating a valuable record, not only from a risk management standpoint, but also from a quality of care standpoint. As healthcare leaders, as CEOs, as boards of directors, I would very much encourage you to do a risk assessment on your compliance programs, evaluate your compliance officer, all the elements that it is actually, implementing, the reports that it's giving, the information that it's sharing, and make sure that they have a good strategic objective to help empower the organization to have a reputation of compliance, have a trustworthy message that they're giving, and really that they're acting with integrity on your behalf. It's really important that as board members and as CEOs, obviously, if you're the best and you have integrity of yourselves and you believe that you are doing things the right way, you want to make sure that your compliance programs are doing the same things. And I would highly encourage you to have a third party do a risk assessment on it. We do it, but other people do it too. It's not proprietary. It's really about understanding what they're doing and are they giving you the right information so that you can have a great strategic, effective compliance program to help you essentially protect your investments and protect yourself. As we look at compliance programs, it's just imperative that they act with integrity and trust. I keep saying it over and over again. It's an easy thing to talk about. It's a hard thing to implement. But at the end of the day, it's the cornerstone, it's the foundation of a compliance program. Especially as healthcare leaders, you want to know that you can trust your compliance people to make sure that they're doing the right things. Thank you for spending your time with us in the Compliance Leadership Lounge. I'm Ross Ronan, and it's been an honor to host today's insightful discussion. If you've enjoyed our conversation, please subscribe, leave a review, and share this podcast with your network. Your engagement helps us continue to bring in-depth and influential content in the world of healthcare compliance. Stay tuned for our next episode, where we further explore the leadership dynamics in compliance. Until then, remember, effective compliance is about leading with integrity, and leadership is about making a difference.